Good morning, grade 9 students. Before we start our class for today, let's have our prayer. Let us put ourselves in the holy presence of God as we do the sign of the cross. In the name of the Father, the Son, and the Holy Spirit. Amen.
How I wanna be, Lord, just like you, and know the good things that I wanna do.
Listen to my heart, Lord. Yes, it's true. When you give your peace and you share your joy and you show your love, oh Lord, how I wanna be like you.
How I wanna be like you.
I wanna be like you.
Welcome, grade 9, to our class. I am Hans Aksalam, your teacher intern for today. And of course, you can call me Teacher Hans. Before delving ourselves to today's discussion, let's have our classroom rules. The first one is honor your learning time. Watch the recorded lesson attentively. Second one, act responsibly online. Answer the assessment with honesty and follow instructions carefully. The third one is note important points. Take notes while watching the video to help you better understand the lesson. And lastly, show respect and self discipline. Practice self discipline even without face to face supervision. To introduce our topic for today's discussion, let's watch this news.
Heart disease and other non-communicable ailments are the leading causes of death in the country. But the status quo need not persist given how preventative action like getting scanned or medically checked up can help turn the tide and extend life, as we hear more from Jillian Geronimo.
Non-communicable diseases remain as the top causes of deaths in the Philippines, according to the Department of Health. The Philippine Package of Essential Non-Communicable Disease Interventions for Primary Health Care, or PhilPIN, is focused on addressing these diseases, especially ischemic heart disease and cardiovascular disease, which are the top two killers in the country.
Ang goal ng PhilPIN is to identify persons at risk of having a cardiovascular event such as stroke or heart attack in the next 10 years. With the PhilPIN, we ensure that these patients receive appropriate treatment and prevent premature death.
The DOH advised patients to have their regular checkups since early diagnosis and treatment is the best way to prevent dying from NCDs.
Ang tawag natin sa hypertension, silent killer. Kasi hindi naman lahat ng may high blood, meron silang sintomas.
The DOH also emphasized the importance of living a healthy lifestyle through avoiding tobacco and alcohol, increasing physical activity, and eating heart-healthy food low in salt, trans fats, and added sugar. Jillian Geronimo for The Nation.
Yes, for today's lesson, we're going to talk about the non-communicable diseases. So open your MAPEH books on pages 290 to 297. I believe that you have your books with you right now. So according to the World Health Organization, non-communicable diseases are illnesses that do not spread from one person to another. So, these non-infectious diseases may be hereditary or a result from lifestyle choices rather than pathogens. So, think carefully with the things you do every day and always choose a healthy lifestyle. The first one in our list is hypertension, or commonly known as high blood pressure. It is a medical condition where the force of the blood against the artery walls is consistently too high. So it is typically measured in millimeters of mercury and is recorded as two values, which is systolic pressure over diastolic pressure. On your books, normal blood pressure is generally considered to be around 120 over 80, while hypertension is often defined as blood pressure consistently exceeding 140 over 90. And now, let's talk about the risk factors that can increase the chances of developing high blood pressure. Number one, stress. Number two, obesity. Number three, family history. Number four, unhealthy diet. Number five, consuming alcohol. Number six, lack of physical activity. And lastly, smoking and exposure to secondhand smoke.
Doctors often describe ailments like hypertension as a ticking time bomb or a silent killer because of the constant threat it poses on the person beset with it. That's why in this year's observance of Hypertension Month, stakeholders want to create more awareness on how to treat and manage such condition before it's too late. Gabi Natividad tells us more.
After giving birth to her third son, Beth was prescribed by her doctor to take maintenance medication for her high blood pressure. Ever since, she has maintained a good lifestyle by exercising, eating less greasy food, and never missing her medications, which, with much joy, brought her good news.
Ngayon, bumaba na yung milligram ng gamot ko sa hypertension niya. Dati 10 milligram siya, tapos once a day. Ngayon, 5 milligram niya.
Beth is only one of the many Filipinos who are diagnosed with high blood pressure and hypertension. In fact, according to the Philippine Heart Association, after the pandemic, there has been a significant increase of individuals diagnosed with hypertension. Unlike Beth, some people are complacent with their health and go on for years before getting their blood pressure checked. This concern was brought up by Doctors Dolores Bunson and Alejandro Diaz of the Philippine Society of Hypertension. They noted that it's quite easy to downgrade the effects of this disease because there's no visible side effects upon contraction. However, they stress that the effects of the disease can lead to some fatal diseases such as stroke, liver disease, and more.
At this juncture, we're going to talk about the protective factors that can prevent and manage hypertension. Number one, manage stress. Number two, maintain a healthy weight. Number three, adapt a balanced diet. Number four, avoid alcohol intake. Number five, engage in regular physical activity. Number six, quit smoking. Number seven, schedule regular health checkups. And lastly, monitor your blood pressure regularly. To introduce our second non-communicable disease, let's watch this news from PTV.
Heart disease, in particular heart attack caused by atherosclerosis or blood clot, is the leading killer of Filipinos. And the top reasons for this health menace are unhealthy diet and refusal, especially among men, to get medically diagnosed or checked out from time to time. PTV's Naomi Tiburcio rounds up the rest of the top 10 leading causes of death in the country, where the COVID-19 virus ranks in this report.
What was the main cause of death of Filipinos in 2021? According to the Philippine Statistics Authority, heart disease was the leading cause. Like ischemic heart disease that killed more than 130,000 Filipinos, followed by cerebrovascular diseases, which caused stroke, blamed for over 70,000 deaths. According to experts, this is not only a problem in the Philippines but a problem faced by the whole world due to addiction, unhealthy diet, and the public's lack of medical consultation.
Karamihan kasi ng Pilipino hindi naman pupunta sa doktor yan or sa hospital hanggat walang nararamdaman. Minsan pupunta yung mga yan pag may nararamdaman na sila.
COVID-19, cancer, diabetes, hypertensive diseases, pneumonia, and many others also recorded high cases of deaths. This is the reason why vaccine is important for infectious diseases such as COVID-19 and pneumonia. For non-communicable diseases, it is important to check your family history for diseases and get an early surveillance.
We advise them to have their regular check-up, the laboratories, the x-ray, mga parang executive check-up ganyan. Then by those diagnostics, so we can tell if yung pasyente is okay pa ba yung health status niya or hindi.
Taking care of one's own health is the best way to give our families the best of gifts. A long life to spend with the people we cherish the most. Naomi Tiborsho for The Nation.
And yes, that's how serious cardiovascular disease is. On your books, cardiovascular disease is a condition that affects the heart and the blood vessels. It may include coronary heart disease, which occurs when a plaque and waxy substance narrows or blocks the coronary arteries. You may ask, how does it work, teacher? Well, it is also on your books. Coronary arteries supply oxygenated blood to the heart muscle. If the flow of the oxygen-rich blood to the heart is reduced or blocked, a serious heart problem like heart attack may occur. Another one from cardiovascular disease is arteriosclerosis. It is caused by high cholesterol, high blood pressure, diabetes, and certain genetic influences. It is the narrowing of the artery due to the deposit and buildup of fats, cholesterol, and other substances on the arterial walls. This deposit could harden and create a plaque. Coronary heart disease can lead to the following. The first one is heart attack. This is the death of the heart muscles due to the lack of blood flow to the heart. Second one is angina pectoris. This is the chest pain resulting from narrowed coronary arteries due to the inadequate oxygen reaching to the heart. And the third one is stroke. This occurs when the blood vessel in the brain bursts or blocked. And now, let's talk about the risk factors that can increase the chances of developing cardiovascular disease. Well, we have smoking, high blood pressure, obesity, lack of physical activity, stress, and family history. And of course, we also have choices that can help us reduce the risk of cardiovascular disease. The first one is avoid smoking and exposure to secondhand smoke. The second one is maintain a normal blood pressure. And of course, the third one is keep a healthy body weight. And lastly, engage in regular physical activities. And the last one on our list of non-communicable disease is diabetes.
Yesterday was World Diabetes Day, a global effort to raise awareness about the disease. But how can we strive for a healthier, diabetes-free world for all? Joining us today via Zoom is St. Luke's Medical Center endocrinologist, Dr. Monica Therese Kating Cabral. Welcome to New Day, Dr. Monica.
Good morning, and thank you for having me today.
Thank you for being here with us. Now, diabetes is such an important disease, but why should we be aware of diabetes? Especially those na baka magsabing wala naman sa lahi namin ng diabetes, or they're not even diagnosed, or they don't know anyone with diabetes. Why is it significant to be aware of diabetes?
Well, diabetes is actually fairly common among Asians, and that includes us. And sometimes diabetes, you don't know you have it until you actually get tested for it, because it's really something that you don't really feel until you have complications. And the complications can only come, 10, 15 years later after you've been diagnosed. So if you have family members or risk factors for diabetes, like you're obese, or you've had something called polycystic ovarian syndrome, or if you are a woman who's had a child and during that pregnancy pregnancy, you had gestational diabetes. These are some of the risks that really come about, and you might have developed diabetes in the next 5 to 10 years. So complications include eye problems, heart attack, stroke. It can affect your kidneys. The whole body really is affected by diabetes if it's undiagnosed and uncontrolled.
That's right. So in short, it can happen to anyone. And like what you said, the complications are really significant and can affect someone's quality of life.
And you heard it right. Diabetes is a condition where the body either makes too little insulin or cannot use the insulin it produces effectively. Well, in a healthy body, when the blood sugar level rises, special cells called beta cells in the pancreas release insulin. So, teacher, what is insulin? Well, insulin is a hormone that helps cells absorb sugar to use as energy or store as a fat. This process brings the blood sugar level back to normal. However, in diabetes, this mechanism doesn't work properly, leading to high sugar levels. Diabetes can lead to many complications in our body parts and increase the risk of dying prematurely. As you can see here at the image, it can cause stroke, blindness, heart attack, kidney failure, and much worse to anything else is amputation. There are also different types of diabetes. The type 1, the type 2, and the gestational diabetes. Let's have first the type 1 diabetes. So, this one happens when the body does not produce insulin. This is because the immune system attacks and destroys the cells that make insulin. The next one is type 2 diabetes. This one occurs when the body cannot properly use the insulin it makes. So, this type of diabetes usually develops in adults. Lastly, is the gestational diabetes. This one happens temporarily during pregnancy. So, always look out to the foods you eat every day and make sure to have a balanced diet. Here are the factors that can increase the risk for diabetes. The first one is being fat or overweight. Excess body fat, especially around the abdomen, makes it harder for the body to use insulin properly. For females, polycystic ovary syndrome or PCOS and diabetes during pregnancy can increase a woman's risk of developing diabetes. Of course, we have family history. Having a family member, especially a parent or sibling with diabetes, increases your risk. Geneticity plays a role in the development of diabetes. And lastly, 40 years of age or older. The risk of diabetes increases with age, especially after 40. As one gets older, the body may become less efficient at managing blood sugar levels. Here are some protective factors to help prevent diabetes. The first one is engage in more physical activities. The second one is include fiber and whole grain in your diet. The third one, lose extra weight. And lastly, make healthier food choices. And that's it for the non communicable diseases. We talk about the risk factors and the things that can help us prevent this kind of diseases. And please, please, please do not forget to always remember that non communicable diseases are illnesses that do not spread from one person to another. I hope that you learn a one, a two, or more from me. And also make sure to answer our 10-item assessment because this will serve as your attendance for today. today's class. Once again, I am your teacher Hans, and good luck to your journey. Thank you so much, grade 9 students, and bye!